Welcome to Auditory Precision. My name is Aaron Shaw. I'm creating a couple web videos and webinars that will basically help individuals pass the test for the state to become specialists, and also for patients that just want to know a little bit more about their hearing loss. What we're going to be doing today is different types of audiograms as far as covering conductive, sensorineural, and mixed. 20 decibels or above is considered normal. The other thing to know about is that when we're dealing with this, the reason why 20 is the point that we consider normal is because by the time that we're adults, we've been around loud noises, we've been around ear infections and viruses, and even for pediatric cases, they should be hearing around 15 for it to be considered normal. So I guess nobody's born with perfect hearing. But the first thing I want to go over is conductive. I find it to be the most easy. I find it to be the easiest to identify. And basically what I'm going to be doing is just utilizing the right ear because I'm utilizing red. And so, say I have what's considered to be pretty normal, an aging hearing loss called presbycusis, usually better in the lows, slopes in the highs, okay? And what is important to kind of add here is that before, they told you just to do octaves and only mark interoctaves when you had a significant gap between the octaves. IHS, which is where we're getting most of our information from, which updated in December of 2016, basically says to never cut corners. They want you to do all octaves and interoctaves, and believe me, it's easier to put it into NOAA when you put it in your audiogram. But for this to be a conductive hearing loss, my bone scores all have to be perfect, okay? That means that they either have to be at 20 or better, okay? If any of these drop below, it is no longer conductive hearing loss. It might have a conductive component, but now we're either going to be looking at sensorineural or we're going to most likely be looking at mixed. But again, for you to say this patient has purely conductive hearing loss, all of their bone scores have to be at 20 or better. Without moving the air scores that I have in my right ear, I'm going to basically show sensorineural. Sensorineural is basically when my bone scores are going to kind of follow my air scores, okay? And I have room of error. I can basically be right on point, or I can have an air bone gap of 10. 5, 10, that's fine. If I have 15 or more, well, we have to mask, and we'll get into masking for bone later on. But if it's 15 and we find out that it truly is 15 after masking, it is no longer sensorineural. Sensorineural means my bone scores have to follow my air and they can only deviate from 5 to 10 decibels. We're also going to notice that my bone scores will never be worse than my air. Sometimes at around 500, we'll notice that this might be lower. It's usually because the oscillator is in an incorrect spot. There are very rare situations like Paget's disease where we will see it below on all of them, but that will be a pretty rare thing to run into. So what I'm going to do is just talk about these two out here. Say all of a sudden, my bone score gives me an air bone gap that is 15 or more. Well, I can't just say that that's true because now I have to mask, okay? And once I mask this, what I would be doing is I would be placing masking noise into my non-test ear, which would be the left ear in this case. And I would redo this. And to prove that I masked, I'm going to be utilizing a different symbol. And so this shows that I did this. Basically, if you have to mask bone, you might as well mask all of them. You can never mask too much, okay? But it is important that you at least mask these because we have an air bone gap of 15. If all of a sudden these are true and they're still at 15, it can no longer be sensorineural. My bone scores aren't perfect. My bone scores aren't following my air scores. And I got these two that are a 15 decibel gap. I now have mixed. I have a sensorineural hearing loss with a conductive component, and therefore I have mixed hearing loss. And that's how you notice the difference between all three.